Very good afternoon, all. It's my privilege to welcome you to this panel discussion on a topic that is both timely and critical to our collective mission, the use and misuse of media in cancer control. As healthcare professionals, we recognize that beyond diagnostics, therapeutics, and clinical outcomes, communication plays a pivotal role in shaping cancer control strategies. In an age where information spreads faster than ever before, the role of media in shaping public perceptions, influencing health behaviors, and supporting or at times undermining the cancer control efforts cannot be overstated. While media can serve as a powerful tool to raise awareness, promote early detection, and dispel myths, it also holds the potential to propagate misinformation, create fear and stigma, and mislead vulnerable patients and families. Media, whether traditional or digital, has the potential to educate, empower, and mobilize the public around cancer prevention, early detection, and treatment adherence. However, same channels sometimes hinder evidence-based interventions.
In today's session, we will explore how we clinicians, communicators, media experts, and public health advocates can collaborate together with media and to enhance cancer awareness while guarding against its misuse. So we are fortunate to be joined by a highly respected and multidisciplinary panel. So first I like to invite our moderator, the distinguished medical oncologist, Dr. Sanju Siriak, and a writer who brings both the clinical insight and deep understanding of patient perspective in oncology care. Welcome, Dr. Sanju Siriak. Also, I like to welcome next Mr. Jayant Maman Matthew, an influential media leader whose expertise in editorial strategy offers valuable insight into how cancer-related narratives are framed and disseminated. Welcome, sir. Next, I welcome Dr. Murali Thumirakudi, a global expert in crisis management and strategic communications with experience in navigating complex public information landscapes.
I personally invite Dr. C.S. Pramesh sir, Director of Tata Memorial Hospital and passionate proponent of evidence-based cancer policy and transparent communication in healthcare. Welcome, sir. And I invite Dr. Nina Elizabeth Thomas, integrative oncologist, a dedicated public health expert whose work in cancer prevention and community engagement provides essential context to media's role at the grassroots level. I invite Mr. M.G. Radhakrishnan sir, a prominent journalist and a media advocate known for his integrity, commitment to responsible reporting and public education. Welcome, sir. With this diverse expertise, we aim to explore the interactions of clinical care, public communication, and policy to foster more effective ethical media engagement in a cancer control. Let us now begin with what promises to be thought-provoking and impactful discussion.
Bit nervous because this is not the typical scientific session where it's much easier to have a conversation with you all. But let's try to learn something today. And this is a post-lunch session. I hope that everybody is awake. And I would request everyone to interrupt whenever you feel so. Just ask us questions so that we'll, have some fruitful conversation today. Now to start with, let me tell you this. We live in a different world now where screens are rather extension of our lives. From toddlers to octogenarians, we know that people just simply love to scroll, like, share, and comment. And, if you ask me, we have information related to healthcare more than ever. But is it really good for us? Honestly, I don't think so. Are we supposed to have so much of information readily available on fingertips? It's much difficult. Even we spend years in our medical school to learn things. Telling people about these things in 5-minute reels, 1-minute reel. I don't know how much they can grasp. Are we leading or misleading? We don't know. Now, when it comes to cancer care, healthcare information is a double-edged sword, because where cancer is one disease where fear meets hope, and myths meet facts. So how to navigate through this complex world is something what we are looking into. Today we have 5 people with us. Unfortunately, one of them dropped out, and I'm so grateful to MG Radhakrishnan sir for gracefully accepting the last-minute invite. Dr. Neena has joined from US through Zoom. She could not travel because of the global concerns right now. And we have Jayant Maman from the Manorama family, representing the print and online media. And MG Radhakrishnan sir, he has worked in print as well as with Asianet, and he can give us insights on this matter. And Murli Tumarigudi, whoever is on social media, I need not introduce him. He is a social media superstar, I will say that. Though he is a disaster management expert, he can give us insights about the use and misuse of social media in healthcare. And Dr. C.S. Pramesh, representing the medical community. To start with, I'll ask MG Radhakrishnan sir, as a person who has been with the public for a long time, representing them, how do you think healthcare information has evolved over time? Do people really trust doctors or media more these days? Do you think that a shift has happened over time?
Thank you, Dr. Sanju. I would say that, this is kind of as you said, it's a double-edged sword. It's almost like a catch-22 situation, I would say. On the one side, you have an unprecedented access for all of us to the world of knowledge, the world of information, and everything is literally on your fingertips. When everything that happens anywhere in the world, it's you have this such wonderful access on the one side. On the other side, it was almost like, in fact, I mentioned this in the article that I wrote for you. It is almost like it's akin to the mythological tale of the cosmic ocean churning. The so-called Palari Mathanam. You have the nectar, you have the Kalakoda. You have the toxic poison coming out from one side, and you have on the other the ultimate elixir of life as the Amrit. Now, information is such a peculiar kind of phenomenon, in the sense that you have this great overload of not just information, but overload of misinformation. How do you navigate this particular problem is something which not just media professionals like us or editors like Jayant who face, even the people who are actually overwhelmed under this huge ocean of misinformation. And how do you navigate this particular situation, through this particular situation, which is a fact and which is something which is called a fake news or fake information or whatever it is. So you have this problem, and only solution to this seems to be a very closer association between the medical professionals and the media, which could at least to some extent, find some kind of solution. I think this is not happening in the level that it should happen, in the sense that you have some inbuilt blocks, sort of hurdles that actually keep us apart. So how do you solve this? Because you cannot, you can always say that there is misinformation, there is fake news, but the solution is not to wish it away, but how to manage this particular situation. I think we should have, as as it was mentioned in the earlier sessions, that the government or the doctor's body or the media should work together and work out certain modalities, certain protocols, certain codes of conduct by which at least, those media organizations which would like to have, the right information or the correct kind of, information about certain, at least we should help at least those media organizations which can actually bring in factual information instead of pandering after fake information. So the problem is that there is actually an incentive to be sensational, in the sense that you have the reels, you have the WhatsApp kind of social media institutions, where if you are ready, if you are going to be sensational, even at the cost of the factuality of a particular point, there is an incentive, a monetary incentive waiting for you. So this is actually an extremely dangerous situation than in the past. You can get paid for spreading lies, even when you're completely conscious that it is a lie. So I think you cannot have a complete sort of solution to this particular situation, but at least you can have a direct kind of intervention in the way that at least certain organizations will be willing, certain media organizations, certain media personalities, media professionals will be willing to cooperate and join hands with the professionals to work out certain solutions.
Thank you. Dr. Pramesh, I would like to take it from there. So they say those who know do not speak, and those who speak do not know. That's what is mentioned. So the problem is, who is going and speaking to the public? So if somebody is inviting us to give a talk, anybody can go and talk to the media now. So how people, it's very difficult to explain to the public the scientific data, whatever is there in our hand. Not all people have that gift of explaining it to people. So, whoever is going there might give a totally different picture. So somebody is inviting you for a talk like this. How comfortable are you to go and speak to the public regarding scientific data?
At a personal level, I'm very comfortable doing that. But I do understand that this is not a skill that is taught to us in medical college and something that we picked up on the way. But I think as physicians, especially when we ascend the path of leadership, you start becoming more senior, your voice is heard, your words are respected. I think there's a great deal of responsibility that comes with it. And it's probably important that we learn the art and science of communication in lay language in a way that it doesn't confuse people and puts facts into perspective. I think Mr. Radhakrishnan did mention this as well, that we crave sensationalism, and it's part of the 30-second culture that we have of looking at reels and actually wanting everything condensed in a format which your attention span can be extremely low and still grasp it. So I think the initial approach that we should take is to make sure that rather than try and fight the system, accept this as a fact of life and use it to your advantage and make sure that the right facts get disseminated in the right manner. And often I think as physicians, as oncologists, we are also guilty of sensationalizing things, and the pressure of having to perform at a very high level, especially in academic centers, has meant that often it's physicians and researchers who hype their findings beyond what the actual facts are. And I'm reminded of several such examples in the recent past which have misled the public. And I think this is important for the public to also understand that this is an era of misinformation. As Mr. Radhakrishnan said, you get paid for lies. So even when we assimilate news of a different nature, so I think this happened during the Israel-Iran war, that everyone suddenly became an expert on defense and war and why someone did this. And I think we are equally guilty of that. And to suddenly blame the public for interpreting medical news that way is probably foolish. And whichever field of life we are in, whichever bit of news that we assimilate, we should ourselves put the filter of, is this true news? Because fake news is much easier to disseminate than the truth.
You are very right. And remember recently the resveratrol hitting headlines that one pill a day can bring your chances of cancer coming back, and the doctors are not telling about that. Now, if that matter, I would like to ask Jayant Maman, as a person who is closely associated with the print media, if somebody is telling a fact that, this particular thing can work, and we all know that nowadays healthcare information is seen almost on an everyday basis. Some hospital did a surgery, some hospital did this. It is actually making headlines, which we never used to see, say 5 years, 10 years back. Is it really helping? Now, if information is coming to your table, how will you validate the scientific part of it? Do you have a mechanism for that? Who do you trust for finding out whether it is true or false?
Thank you. That's a very good question which most media organizations face. I think a lot of hospitals these days, I'm not blaming hospitals, they will send out a PR. So our policy is when a medical breakthrough or something of that comes from a hospital, we always try to find out from other sources, medical sources always, to see what is it that they're trying to convey and what is the achievement, what is the breakthrough. So we don't try to hype a PR from a hospital, because once we start doing that, then every hospital will send out a press release. So this is what we try to do. We don't have a medical panel, but we have doctors who we contact and who we feel are at a position where they can give us the best advice. So this is, it happens to us in print. The immediacy of television, sometimes there could be slip-ups, but print, there is a lot more time for us to verify. And that's one of the advantages of print in this digital medium. Having said that, it is a challenge. It is a challenge because there is so much of breakthroughs happening in medicine now, in terms of drugs, treatments, successful surgeries. That's on one side. Then on the other side, then you have these alternate treatments as well, which is that's a completely different approach which people are taking, and people are much more gullible for those alternate treatments. So it is very, very, very difficult. I'll just give you a quick example and stop. When I told my dentist, Dr. Shaji, who Dr. Bobbin knows, that I was coming here. So he said, there is this reel which is circulating on social media, which says that, now I guess checking for oral cancer and all that if you check for black spots in your mouth. So he said patients come, every day they're looking for black spots, then they'll find something, they'll press that part, and they'll come to the dentist and say, I have cancer, please check. So he said it's unbelievable what's going on. So a lot of this is the people from the other side who are disseminating. Many of them, we don't know if they are doctors or not, but these days in social media, everybody is a doctor. And there is no way to verify whether that person is a doctor. One way to get out of this, to make it much more reliable, is that medical associations, they should be the ones who should be disseminating research or any kind of information.
I understand. So there comes the importance of social media. Now, social media, I don't know how to explain it, but then everybody is trying to be on social media. We are also forced to be on social media, because unless you come out and tell about what's the right thing, people are easily going to get misled by whatever information is shared by anybody who can speak and post a video there. One issue what we found is like what you told. Yes, we have to come to the forefront and talk to the public, but say, for example, I am posting a video with great effort, calling someone, or say personally taking a video and posting it on my Facebook page, it will hardly hit 1,000 views. And anybody who is going to tell a fake treatment, we are going to see 1 million views. Now, how will you handle that? So, whatever we are going to sincerely do, passing on a genuine information, why is it not accepted? Are Malayalis having a negativity bias? People want to go behind the fake things only?
Thank you, Sanju. First of all, thank you to the organizers for inviting me to this event. I was telling my friend M.G. Radhakrishnan that once I cross 60, I proactively accept invitation from medical fraternity because I'm more likely to come across you than college teachers and others. So thank you for inviting me, though I'm really not looking forward to being in your consultancy room, but I may. Now, the point you mentioned about why is that fake news trends or go viral more than normal news, there's a recent NHS study, I think, which came in 2023, which said that bad news travels 3 times as fast. But the number which you gave is probably more true, that is between 1,000 to 1 million. Now, there are 3 separate reasons for this. First of all, when you are in distress, you are desperate. When you have cancer or somebody close to you have cancer, you want cure, you want solutions, you want instant solution, you want easy solutions. You do not want a very scientific explanation. And fake news, pseudo solution, give it very easily. So this is number 1. So you proactively seek out those simpler magical remedies. The second reason is that the Facebook algorithms proactively promote what is likely to go viral. The point you mentioned, that there is an incentive for you to spread lies because it still brings you money. If you give good news, it doesn't go viral, and Instagram, Facebook, YouTube, others, they do not make revenue either. So therefore, they do not proactively promote this. And I think this is one area where institutionally, legally, we can probably intervene and ask for the algorithm to be made public or be fixed, especially in the case of healthcare. There is also a third reason, which is more institutional. Community in general have some sort of a distrust towards big pharma, corporate hospital, as you saw this head this morning, and so on. So they somehow assume that the legitimate information coming from doctors is somehow biased because there's a commercial interest behind it. Now, the doctors who are coming out of the medical colleges, as Pramesh mentioned, they're not trained to communicate this effectively in a language which is comfortable or something which is accessible. Now, I'll give you one example where I had been to maybe 1,500 separate platforms to speak. In each one platform, the last question to me is, Sara, Mulla Periyar Pottu. Will Mulla Periyar burst? And now I know a scientific answer, and I try to explain, this is... If I were to say that it will not burst, it's not about the common knowledge, so people are very unhappy. If I were to say it will burst, all my civil engineering friends are very unhappy because that's not very scientific. So I have now learned this magic trick. I was speaking to the Kerala cabinet, all cabinet members were there, and they asked the same question. I said, ഒരു അണ കെട്ടുന്നതും പെണ്ണ് കെട്ടുന്നതും ഏതാണ്ട് ഒരുപോലെ തന്നെയാണ്. കെട്ടുന്നത് എന്തും പൊട്ടാനുള്ളൊരു സാധ്യതയുണ്ട്. പക്ഷേ എന്ന് പൊട്ടുന്നു എന്നുള്ളത്, എന്ന് കെട്ടി എന്നുള്ളതിനെ അനുസരിച്ചല്ല ഇരിക്കുന്നത്, എങ്ങനെ കൊണ്ടു നടക്കുന്നു എന്നുള്ളതിനത്. And people got the message. And it's often about translating this to something which people can relate. And that's a skill which you have to learn, as Pramesh mentioned, but also something which can be taught. Thank you.
Thank you. Thank you so much, sir. So, Dr. Neena is waiting from US. So, Dr. Neena, can you tell us about integrative oncology? I'll come to the second question once you explain about integrative oncology. What exactly is integrative oncology?
Want to start with a clarification. I was introduced as an integrative oncologist. I'm not. I am a family physician trained and working in United States. I'm also in integrative medicine, so I'm double board certified in family medicine and integrative medicine. I practice integrative medicine in the context of continuity care or family medicine, but I also do consultations. So for my own patients who are diagnosed with cancer, or sometimes they come from the cancer center to get my recommendations on integrative management. With that, what is integrative oncology? So the definition of integrative medicine is looking at a person as a whole person and integrating all therapies and treatments, evidence-informed, that's required for the healing of the body, mind, and the spirit, including their genetic makeup and environment. So in integrative oncology, your mainstay is your conventional medicine treatment, but there's, to explain that, I want to explain a little bit about what is conventional medicine, which we all know, we are conventional medicine doctors. What's alternative medical systems? Alternative medical systems are whole medical systems like Ayurveda or traditional Chinese medicine, who also can come from different philosophies, but can also treat a wide variety of illnesses like our conventional medicine or allopathic medicine. And then there's alternative therapies or complementary therapies. Sometimes they are independent, like a osteopathy manipulation, or a guided imagery, or sometimes it could be a particular therapy from a whole medical system. For example, yoga or meditation that originated in Ayurveda or Indian system, or acupuncture, which is not the whole traditional Chinese medicine, but a treatment modality. So integrative oncology or integrative medicine in that sense to any specialty, you are using your knowledge and training in the diagnosis and treatment for a particular condition, but also incorporating other modalities that's appropriate and with less risks and evidence informed. So in integrative oncology, you will go through your conventional diagnosis, staging, and treatment, whether it's surgery, chemotherapy, or radiation therapy, or immunotherapy. But as part of the treatment to tackle the side effects or the mind-body aspects, you may be using, and you must use the diet, the physical activity or exercise part, working on the habits. Maybe you would use acupuncture for pain relief, for nausea, for vomiting. Maybe you would use appropriate supplements. Of course, you may use a guided imagery or a mind-body approach. You would cater to the needs of the spirit, not in the religious sense, but bringing, in tackling with their belief system, their meaning and purpose, and joy in their life. And there are different modalities, especially in our hospital. We incorporate music therapy, art therapy, and narrative medicine person, psychologists. So, and we can expand on it. So that's the whole idea of integrative oncology.
Thank you.
And from the time of diagnosis to palliative or hospice care.
Understand. So let me ask from senior people in the crowd. So is this something which we can adopt, because they say they give the traditional scientific treatment along with other treatment? What's the opinion of the audience? Dr. Warrior can answer.
Definitely we can think about it, but the only issue is in Kerala, when we talk about the integration of something, any other stream of medicine, then the problem of quackery comes, all other it will deviate from the main with the focus.
The alternative medicine
Alternative
people might
med-
take the center stage.
Yeah, so that is the only issue. And some of the collaborations we have tried at MBR, we couldn't continue that because of the other issues. Like, suppose you are collaborating with an institution for conducting research on Ayurvedic drugs, the impact of Ayurvedic drugs in the management as a adjunct treatment for the cancer, along with the main, without deviating from the main guidelines. Then the issue is this Ayurvedic drugs will be projected as the probably a wonderful drug. You would have, since you are talking about the media influence and all other things, you would have seen the ashwagandha, the way ashwagandha was promoted. I should say that because I have treated him, he got better with the modern medicine only. But the way he projected, everybody took ashwagandha as the remedy for the cancer. So such things will happen in Kerala. So without our population or without our people realizing the role of each part, it's difficult to integrate. This is my personal opinion.
Understand. So, Dr. Neena, so how do you prevent, doing such things, integrated medicine, not becoming a sort of pseudo medicine in US? Because, here, whatever other modalities are, whatever is mentioned, the traditional scientific treatment, whatever is not traditional, and the scientific treatment will be considered as pseudoscience. So, how do you prevent from making it not a pseudoscience?
I agree with Dr. Warrior. It's a little touchy subject in India or Kerala, visiting there and try to understand what's happening there and what's happening here. I think in America, this about 20, 30 years ago, the situation was like that. There was a lot of skepticism. But my professor whom I worked with, Dr. Andrew Weil, I think he was a pioneer in this field. He's the one who coined the term integrative medicine rather than holistic medicine or alternative medicine. Over the years of work and making this very formal through a university, hospital, or medical college setup, eventually it gained momentum and people started trusting. So in India, it's a touchy subject because, we have our own ancient system and people, it's all depending on patients or our society's trust and mistrust. So it becomes our responsibility as evidence-based or conventional medicine people to put out their courses, education, both for the doctors and for the patients and the society, and in a government level or system level, organizational level, rather than ridiculing or criticizing the alternative practices or medicine, and very factual and in a way that our patients and our society and families would eventually buy and look up to us and trusted sites and media for information.
Thank you. Dr. Raju?
Yeah, so AMPOC actually conducted the cancer awareness survey. So we asked a question to the 2,500 public. This question was, do you believe alternative medicine alone is sufficient to take care of cancer? And Malayalis, only 3% said alternative medicine alone is sufficient. That is, vast majority of Malayalis believe that you have to go to a proper doctor. But the same survey, identical question done by American Society in the US, 4,000 adults, the response was 35%. 35% Americans believe that alternative therapy alone treats cancer. The difference between the US and India, despite the difference in the number, is that there are better legal frameworks and regulations in the US. Therefore, they are protected. Although 35% of the people in the US believe that alternative therapy, quackery, is enough, they can't access it because it's highly legally regulated. Now, in the absence of proper legal regulations in Kerala or in India, we will go for a toss.
Yeah. So, Dr. Pramesh, this is a common scenario what we see in our clinic. Say somebody tomorrow is diagnosed, a patient is coming to your clinic with breast cancer, and she comes and tells that, no, I don't want this treatment. I want to go for this fake, whatever cure is mentioned in a WhatsApp forwarded message. How will you handle that? You all face this problem. How will you tell, what will you tell the patient?
I think it's important that we share the right information with patients, and probably this is a situation which would take a lot more time to actually discuss with the patient than a normal consultation would. And finally, the answer lies in laying the facts on the table, giving the data in a way that it's not jargon and it's easily understandable by the patient, and hope and expect that the family with the patient would make a sensible decision. Coming back to the previous question, I think this is a universal problem. I don't think it's something restricted to Kerala or to India. During COVID, some of the most rampant misuse and abuse of drugs were from high-income countries. We had ivermectin, including the US president, who propagated hydroxychloroquine and at one point even bleach as a cure for COVID. So I think this is a universal phenomenon, and it's effective communication of science in a lay language which emphasizes the facts without making it too technical is the key to most of these problems. And I think regardless of which form of medicine, ivermectin is a as you call it, modern medicine drug, but it is being misused. Similarly was hydroxychloroquine. So regardless of the form of medicine, the emphasis has to be on evidence base. Whether it's Ayurveda, homeopathy, Siddha, whatever it might be, unless there is data, trials to support it, I don't think we can take the easy way out of saying that these are harmless drugs, there's nothing, what do we lose in giving it, and at best, at worst, it may do nothing, but at best it can actually relieve symptoms. A lot of them are actually harmful.
So, Jayant, my doubt is about the fear of FOMO among media professionals. So, because people run after sensationalism. So, how is it real? Does it exist in media circle? To get info, because you have one news, you can see that it is there in 100 media platforms. Everybody is going to share that in some way or other. Is it real?
No, I don't think so. I think you should separate social media from media, and I think there is a big difference. You'll find a lot of this stuff going on in social media, but if you actually look at established mediums, you will not find this race to break something. In print, it doesn't happen. I know for sure it does not happen. Even television, I mean, no health, unless it's something which is all over the world, I don't think a TV news channel will have that on breaking news. And most of news platforms will always have a doctor as a panelist. I don't think a reporter can ever substitute for a doctor as a panelist. So that will never happen. And there are enough doctors who are, he mentioned that not everybody is a good communicator. But now there are lots of doctors who are very good communicators who are able to, communicate in very simple terms. I think that's the key. And another thing is things which are very technical in nature, it's not for the layman anyway. It's only for the medical community. So that there is no need to communicate that to the public.
So whatever way we communicate in a social media post, you can you want to get depressed, just go and read the comment section of any post. I feel if tomorrow Mark Zuckerberg is going to ban comment box of Facebook, world is going to be a better place. How negative our people are. You go and see any TV channel, YouTube, the live scroll, just see how people respond. Why are our people like this? What joy are they finding in this? Don't they understand that, they're actually going to get depressed by typing all those nasty comments?
Thank you. I actually have a different opinion. The main reason why I write Facebook post is to read the comments. Because that's my biggest entertainment of this. And I must also say that it has made me a better commentator, because there are a lot of people with a lot more specific domain knowledge on the topic which I am writing. For example, if I were to write about medicine, somebody with a lot more precise information would come and augment, counteract, etc. my comment, my post, and it enriches the discussion, but also it enriches me. So certainly I am for one who is fully in support of comments. But certainly there is a problem. You have people who are abusive, people who are always attributing motives. For example, half the time when I write something, I'm told that that's because I want to be an MLA in Kerala, that's why you are writing this or that. Anything good I write about Kerala, instantly it is said, oh, this is because you want to be an MLA or something. Now, many times I have been, in the social media language, I have been up in the air by people, abusing me. And I have not even once, I have thought about closing the comment section, because if you look at the counterfactual, the situation when there is no comment, I think the world will be not a better place. So therefore, I would rather have the comment section take the brunt. If it is personal abuse, my philosophy is that if somebody abuses somebody who has commented on my post, then I will block them. But if somebody abuses me, I'm okay, because I'm in public domain, I am prepared to be abused. That's how I take social media. Thank you.
Thank you, Doctor. Thank you so much. Dr. Pramesh, you can answer this. No, he is looking for comments to improvise himself, and do you think your post underneath somebody is coming and abusing you, you will be happy about that?
So I think...
Are you active in social media?
I'm not as active now as I used to be, but I am pretty active on Twitter. I became less active after Musk took over for reasons well known to most of us. I find any kind of abuse objectionable. It's not something that I'd tolerate. I'd much easier mute or block them rather than have to go through this again. And I think a lot of this is because of the anonymity that social media provides us. You are here, even if I disagreed strongly with him, I wouldn't abuse him. Somebody with a very often nameless troll has the anonymity that social media offers, and even if it's a named person, nobody knows who the person abusing is, so it gives them the freedom to abuse. So it's a fact of life, and if you're active on social media, I think you need to be prepared to take that. But I also feel that we can use this in very constructive ways to actually disseminate information which is actually useful for the public, and if we say whether we wish social media away or not, we need to look at the positives of it and make sure that we don't get away from that. That's the reason I didn't totally take myself off from Twitter, because it still gives you the opportunity to disseminate information in which is actually true.
Now, to the people from non-medical crowd, so do you people really look into the Google reviews before visiting a doctor?
Well, I do, because we are all part of the same.
But you know that most of the times it is cooked up.
Yeah, that is right. But you trust your own kind of senses or your own perspectives to some extent, that you have you get a feeling that this is not right, and so I think I trust myself to some extent. Maybe I might go wrong even in my trust, but I think I have certain senses or certain things that inside me who tell that this is not right, or this fellow is not right, or this particular information is not right. But it comes through experiences and it comes through years. That should not be the case with everybody. But I think another issue is that this is not something you can see in isolation, because this is something which is happening in every field of life, every aspect. That is why unprecedentedly we are going through a post-truth age, where everybody wants truth to be what they think that is truth. They know that the truth is something else, but they still think that I don't support that particular truth, so I want to be in this particular. And this has been amplified by the emergence and hegemony of social media and silos like WhatsApps, and we are all in the same group. It's all echo chamber. We listen to our own voices. So unfortunately, when it comes to the field of medicine, it becomes literally a life and death issue. That is the only problem. Otherwise, we are going through this particular stage in life. I don't know what is going to happen. And as Jayant said, the problem is that social media is, far more mischievous than any other thing. But unfortunately, the legacy media to which I and Jayant belong has been completely, outmaneuvered by the social media. Now, all over the world, not just all over the world, even in a small state like Kerala, studies show that more than 60% of people depend now on social media as a primary source of news. So, there is no going back now. Now, this has become a fact of life. Even in the world of media, even in, and this particular universal tendency of people going after negativity is also, it's a well-proven thing. Every social neuroscience studies have shown that people go for, the messages should be negative, they fear and anger are the things that actually they are pandering for. Instead of, if you have a good thing to say, nobody is going to care. So I think, this is happening in the world of politics, in the world of sociology. Everywhere you have this problem of spreading false information, misinformation, fake news. And the only solution that has come out is to have an institutionalized fact-check systems. Everybody, I think the doctors should come out with a number of multiple, fact-check systems. And this is the only way. Otherwise, this is not going to change however much we would like to change. So I think this is the time to use social media, to use the same weapon to fight against, what's that wrong thing. So I think, more and more fact-check kind of systems have to be introduced, and by professional bodies like the doctors and government or whatever it is.
Yeah, the one extension of what you have said, that Google reviews, as far as the oncology doctors are concerned, it carries a very, very high risk. The reason being, when somebody is made to wait for a long time, or in the OP, if we are not able to see them on an expected time, then they will write reviews. Secondly, when the disease is not in our hand, when the disease is coming back again, and then there is a frustration of the person who is taking care of the patient, also will be expressed in the Google review, but it does not have any relationship or any truth. That is what the important problem we see. And as per the rule, the medical council has discouraged reviewing as well as rating the particular doctor. That is the current scenario. And the second point, the extension of what you said, the 60% of our people depend on social media for all this information, but that is to a very distorted type of information. I'll tell you, if I treat a patient successfully, nobody is going to read about that thing. But if someone is writing, Dr. Warrior രോഗിയോട് എന്താണ് ചെയ്തതെന്ന് അറിയുമോ എന്ന് ചോദിച്ചിട്ടൊരു title കൊടുത്താൽ, then everybody will be reading that.
Unfortunately, this is a universal phenomenon. This negativity bias of human beings is a fact of life. You have to live with that. So only thing is, that's why I said, the only sort of antidote is to come out with better information, rightful information, etc. But people will be always going after, the wrong information or the false information. But unlike in the past, truth has lost its, its value almost on a total basis. So this is something which you see in every field of life.
So, Jayant, before we conclude, so how do you think this is going to evolve in the future? You are part of Manorama family, who's there in the print, online, social media platforms, TV media. So how is it going to evolve in the future? Whatever is mentioned here is scary. And do you think the future is going to be better?
Well, I'm an optimist, but social media is here to stay. They will not give you their algorithm. They make their money off the algorithm. Google has done few things in the past 6 months to a year. They are tying up with various organizations as to talk about fact checks. I'm the ambassador for Factshala in Kerala, Faiz in Kannada, Shekhar Gupta in Hindi, and so on and so forth. But what was interesting is the moment our videos came out, we got trolled. So there's always going to be a percentage of people who will continue disinformation, fake news, because it is not that there'll always be a disruptor for information, because they feel another side is what is the correct side. So as he said, there's, truth is completely blurred now. But what I think from the medical field, from associations, your Indian Medical, IMA, Medical Council, all of you can come out with a fact-checking network where you have, so we are the only certified members of IFCN in Kerala, that's International Fact-Checking Network. So similarly, for medical information, you can always say that it has to be certified or authorized by one of your associations. And that should go in all the posts. So if a doctor is talking about something, maybe like a stamp, it can be there. Run a campaign saying that unless that stamp is there, don't believe in the information which has come out. So hospitals will also have to cooperate in that. But here, there'll always be someone says, no, I don't believe in that, but insist on it. If you're a member of our council, then have the stamp of that fact check, or IMA verified, or medical council verified, things like that. So but you have to make a start. That's the most important thing. And media is always there to help and support, because we also want to disseminate the truth.
So I think that should be the nutshell of the entire discussion. Probably AMPOC can take an initiative. We had multiple discussion on this, of taking smaller topics and disseminate the knowledge about cancer, which will be authentic by one association, cross-checked, verified by a group of editorial team. And if we can use our social media handle and even our website, we can always tell our patients to go for fact-checking, check with whatever information is mentioned in our association social media handle, and get enlightened. That's it. I think we should take step, right? So I think that should be the conclusion of this.
ഒരു ചോദ്യം ചോദിക്കട്ടെ?
Yeah.
ഞാനൊരു സോഷ്യൽ മീഡിയ റൈറ്ററാണ്. സോഷ്യൽ മീഡിയയെ കുറിച്ച് കുറ്റം പറഞ്ഞു അതുകൊണ്ടല്ല, ഈ ഹോസ്പിറ്റൽസ് പൊതുവെ കഴുത്തറപ്പൻ സമീപനമാണ്. ഹോസ്പിറ്റൽസ് ആർ ലൈക്ക് ഷൈലോക്സ് എന്നാണ് പറയുക. ഇതുകൊണ്ടല്ലേ ആൾക്കാർ ഈ ഗൂഗിളിൻ്റെ പുറകെയൊക്കെ ഇങ്ങനെ ഈ താങ്ങാൻ പറ്റാത്ത ആ ഒരു ചികിത്സയുടെ ഈ ഒരു ഭീകരത കൊണ്ടാണ് പലപ്പോഴും ഈ സോഷ്യൽ മീഡിയ ആൾക്കാർ ചൂസ് ചെയ്യുന്നത്. നിങ്ങൾക്കതിൽ എന്ത് ചെയ്യാൻ പറ്റും? അതൊരു ഫാക്ടറല്ലേ? ഒരു മലയാളിക്ക് അഫോർഡബിൾ അല്ല ഈ ചികിത്സാ രീതികൾ. ഉദാഹരണത്തിന് ഒരുപാട് ഹോസ്പിറ്റൽസ് ഉണ്ട്. യു നോ ദാറ്റ്.
If I could answer that, whenever I write a social media post supporting doctors, I get this argument all the time, and it's extremely difficult for a doctor to counter this argument, because first of all, they are institutionally bound by certain principles, whereas people who are outside, and that's why you should actively, as much as you create your own fact check, you should also actively collaborate with social media influencers who are not medical professionals, who can in a way vouch for the integrity of the system. I'm not saying the hospitals do not have challenges here. I'm not saying there is no big pharma issue. But if you look in totality of the system, especially in Kerala, healthcare is one of the most affordable, comparable to anything. If you just want to know it, you just have to cross the Kerala boundary and go to Coimbatore or Karnataka or any other place. And suddenly you will see how efficient and economical our system is. But I agree that the fact which most people want to believe is that our hospitals are Kadutharappan and there's a hospital mafia, etc. I entirely do not believe in it. I'm sure there may be one or two here or there. There may be instances. But if you want to paint the entire medical system, especially the private sector medical system in Kerala as Kazhuthurappan, that's something which I will not entirely support it based upon any amount of fact which we can objectively present, but probably we don't have time for that. Thank you.
Thank you. Thank you all my panelists. I think we'll stop it.
Thank you.